So thank you, panel. I really appreciate all of the different types of social workers we have on our panel today for our macro social work panel. Many of the social workers here today didn't start as macro and maybe don't even identify as a macro social worker today, but all of them use different macro methods. So I would like to ask each of you, I'll call on you, to please introduce yourself in about 5 to 7 minutes and describe some of your day-to-day work. And then I'll go through some questions from the students that they've submitted before class. So I see Sue here first. So Sue, could you please introduce yourself and describe a little bit about your day-to-day work as a social worker?
Absolutely. Hello, can everybody hear me?
Just a little louder, please.
Okay, I'm gonna try to turn it up. How about
this? Oh, perfect, thank you.
Okay, so I am Sue and I am very excited to be speaking with you today. So thank you so much for having me. So I started off, I wanted to be a marriage and family therapist. And that was my dream. And I was going to the school of psychology. And I said, no one's going to turn me around, right? And I'm going to get my PhD. And I have a professor that stops me. And she's my mentor. And she says, well, based on what it is that you want to do, I don't understand why you're going to get the PhD in psychology. She said, I think you would be great as a social worker. And she said, and one of the other things I think you should do is, she said, look into social work because it's so many different opportunities. And I said, okay. So that's what I did. I went to the School of Social Work, and then I said, okay, great. So I was in undergrad, and then I went and I looked at it, I checked it out, and then I learned that this was exactly the things that I was interested in. And so then I went to my master's class, and I applied for a master's at Wayne State, and I was very excited to get to work with so many great leaders. And I was still focused on being a marriage and family therapist. But then my internships, that's what really turned things around for me. And I really saw the way the impact that I could have on multiple people and the policies and whatnot that I could change and impact. So I started off at Carbanus for one of my internships, and then I stayed in healthcare during all that time. And I've been in healthcare for probably the last 10 years or so. So I didn't believe that I thought that I was going to be in healthcare as a social worker, a clinical social worker, which is normally what we see. However, I manage programs, I manage outreach programs. And right now I'm starting a new position managing pediatric programs for the adolescents and young adults. So I'm really excited about that. But what I do when I manage programs is I analyze data. And I start to look at ways that we can improve care for families and patients, as well as how can we either increasing patients, and then so that we increase revenue. So it's a lot of great things in social work that sometimes we feel limited. And I know that I felt that way. When I first started off, I thought that social work, well, no, not social work, but I thought that there were just so many limitations, but the possibilities are endless. I have so many friends that are doing great things. I have one friend that's a chief development officer right now, and it's all in social work. She learned those skills, and we continue to talk about the importance of leadership, and we talk about the importance of building relationships throughout our time. So I still keep in touch with that professor that told me that. And I'm so grateful because even though I still work with clinical social workers, they always give me a lot of respect and saying, we don't really get macro. And I said, oh, okay. But I also did clinical social work as well. I was at Carmanus, I was a clinical social worker, but I really enjoyed my time as macro, and I'm not turning back.
Well, we're glad to have you. Thank you, Sue. Next, I see Uma. Uma, can you, I know you have extensive career, but if you could aim for about 5 to 7 minutes, tell us a little bit about your journey.
Sure. Hi, everyone. So I'm the 28, I think it's 30 years now. So I got my master's in social work in 1989. And actually, I got it in India. And I came here and I did take, I have a second master's in health administration. So that's a little bit of my journey. I started when I came here. First, I had to get my licensure done and all that good stuff. So get my degree validated, took the licensing exam, did a bit of clinical work, right? But pretty quickly in my career, my first sort of quasi-admin job, macro job, was running a social services department in a nursing home, in a long-term care facility. And then from there, I went to an area agency on aging, and I was again sort of a case carrying director with supervisory responsibilities, trying to get, you know, revenue because it was a nonprofit, and trying to make sure that it had another diversifying fund source, which you'll hear a lot about as you get into this field. And then I landed in government, and it is my first and probably really abiding career choice. Though I'm not in government right now, I spent 22 years in government, and I ran child welfare for the state of Washington, for the District of Columbia, for several county governments. And in between that, I spent a little bit of time in a governor's office, because I said, as an immigrant, if I really want to run systems, I need to understand how the legislative branch of government works. So I very intentionally went to the governor's office. That was my first political job. And when the Democratic governor didn't win and the Republican came at noon on Inauguration Day, I lost my job. And I couldn't understand why that happened, right? That was my first political job that I lost. And I'm like, but I'm so good at what I do. Didn't matter. Then I've lost 4 jobs for political reasons. So there is a term in DSM-5 for masochistic personality type with self-injurious behavior. This is key. I'm the poster child for that. Anyway, so then I left the governor's office and I went to Washington State, ran child welfare there for a few, maybe less than 2 years, and I lost my job again. Child fatality is pretty brutal, you know, but lots of good child welfare reform experience. Then came back to DC because my base is here in Maryland and DC. So I came back here, and then I worked in DC for a couple of years, and we were almost out of consent decree. I don't know if any of you are child welfare practice majors, but child welfare and developmental disabilities and mental health, and some of these fields really do struggle with consent decrees. And so we were almost close to exiting the consent decree, but then the mayor changes, and they have a residency requirement in DC, and I live in Maryland. So time to look for another job. And so I went to county government, and I was there for 12 years running a county integrated health and human services department. And it is the best job I ever had, and ton of fun. 12 years is a long time. So really deepened the work and the practice. And, you know, can talk about grants and contracts and supervision and labor unions and a whole bunch of other things that are policy, legislative advocacy, how to frame budgets, all those good things, right? Experienced all of it. It went from public health to human services, to aging and disabilities, behavioral health, children's services, homelessness, public health. I had all of it. It was a ton of fun. And then my boss leaves after 12 years. And I was like, okay, for 4 times losing a job for political reasons, enough already. So I'm a consultant now in the private sector. I'm the managing principal of the DC office for Health Management Associates. I've been there for almost 2 years. Really hard to make that transition initially. It took me a good 10 months to make the switch. That's kind of where I met Carrie, in that role. And so here is where I am.
Thank you.
Talking. Yep. Thanks.
Next, I see Brittany.
Hi, everybody. Good evening. My name is Brittany Sandefer. I live in North Carolina, and I'm a fundraiser. So unlike what Carrie said at the beginning about how a lot of people in macro don't really plan to be in macro, it was exactly what I wanted to do. And it's the reason I got my master's in social work. So when I was in college, I was a pretty big activist, really involved in a lot of community-based programs. And I thought that's what I wanted to do for my career, be a community organizer or work at a community health center, that kind of thing. But once I started doing that work, I quickly realized that that industry was sorely lacking in two primary areas: good leadership and money. So I thought, well, how can I address that, but without going to like a business school or another organization that didn't have a focus on the communities that it serves? And I was fortunate that the Michigan MSW had the management track, so you could get the focus on vulnerable populations, but you could get the practice area that worked for you. So I did the management program not knowing what area I wanted to be in, and then ended up in a fundraising class that I absolutely loved. And I knew I wanted to be a fundraiser. But it's really hard to get into fundraising in small nonprofits because they usually either don't have one on salary or they have only one on salary. And if that position's filled, there's no room for anyone else. So I started at a small domestic violence shelter and sexual assault advocacy agency in volunteer work, because volunteers are fundraisers, right? The three things that people can give any organization are time, talent, and treasure. So that time one is where the volunteers come in. And then I started working at the Medical Foundation of North Carolina because I wanted to really learn about best practices and gold standards in fundraising so that I could be prepared to bring those to a community setting. So I started doing development work on the prospect management side. So learning about who donors are, why they give, who should work with them, managing a portfolio for a large team of fundraisers that traveled the nation, raising money for UNC School of Medicine and its hospital systems. And then took that to the University of North Carolina at Pembroke, which is a small rural four-year institution that serves a uniquely diverse population that's historically American Indian. And spent the last 4 years there until recently I transitioned to the Jackson Laboratory, which is based out of Maine, but with offices in Connecticut, Sacramento, and Shanghai. And we raise money for biomedical research and try to find people who can help us find solutions for some of the world's worst diseases. So I just really, a lot of people think that asking for money is uncomfortable or hard, but I love it. What I have found is that you're not asking people for money. You're finding people who share the passions that you have about making the world a better place or serving a particular community, and you're telling them about your work and asking them to join you. And they're actually grateful for it, right? Most people who give want to give, and you become the conduit through which they do that. And it's so important, as I'm sure Carrie's worked with you on. I mean, there's very limited revenue streams for the organizations that do some of the most critical work in our society. Grants are hard to get, expensive to maintain. Actual like producing something that sell is almost impossible in a nonprofit setting. So private support is where the rest of the money comes from. And it's so important because it's more flexible. There's no one expecting 20-page documents for you to turn back around in a day because they gave you $1,000. You know, I have donors who can give $100,000 and they never expect any kind of anything in return except for a thank you and to be kept up to date on what the organization's doing. So I just really found my niche and I love doing it. I do it for nonprofit organizations too, by sitting on boards. And I'm looking forward to answering any questions you have and talking about it more.
Thank you. So Brittany, you mentioned the relationships and finding people's passion and being invited in. Those are all very strong interpersonal skills. So even though you wanted to go straight for macro, you do still need the other skills too. You know, so social workers can't do anything with just one set of skills.
Yeah, absolutely. And it's just interesting that out of all the things that people tell me about why I'm a good fundraiser, the top two are being a good listener and being a good communicator. So it's really the same that you would, I mean, that's true for almost any job, but I think I credit my social work training and social work passion as the reason for that.
Yes, thank you. Next I see Raylando. Can you please introduce yourself and tell us about your social work journey?
All right, so good to be with everyone tonight. I'm Rolando. I'm a social worker, social justice educator, and also an organizational consultant. I write, and I do a little bit in terms of using like media and education to communicate about social justice issues. So originally I was going to go into the some of the medical sciences. So it's particularly like physical therapy at that time. My father was at the time when I was entering undergrad as a first gen, as a Black first gen college student. At that point, was at a point where he was having some challenges with like signing his name and some other like mobility related things. And so I thought to myself, okay, so I'll get some of this this medical education, and I'll help my dad, and I'll help other folks like him. And I got into some of the classes, like the chemistry, the bio, which are all very, very, very important subjects. But one of the things that I learned is that I struggled with at that time, like the memorization that was required in some of those courses. And so I was convinced to take an intro to sociology class, and the professor at that time, the professor I had started using words like gentrification. And so I'm like, wait a minute, gentrification. All right, so what is that? And so began to learn a little bit more about that, you know, roughly, okay, so you redevelop a place in the name of like revitalization and a lot of other things that ultimately ends up displacing the people who were there first, can no longer afford to be there. And it's like, oh, wait a minute. I know what that's like. I've experienced that. I've seen that happen. And so this is also on the heels of me growing up, just having a lot of experiences, particularly at the intersection of race and class, that just communicated that, you know, if you were Black, you didn't matter. If you were Black and poor, you definitely didn't matter. And it was also your fault. And struggling with those messages that were classist, that were blaming people who were poor for the challenges that they experienced. And then also a lot of anti-Black messages too, around like dark skin not being attractive, around our hair not being of value the way that it is, you know. And so really struggling with those messages and even seeing things. So like when I was in high school, one of the things I would notice that at that time, I didn't necessarily see it as like a macro related thing, but it's a pattern that I noticed. Like I would run track in high school. And so I would, when I would practice, there's this one particular intersection, Finkel and Lazar in Detroit. And the further I would run down this one particular direction in Lazar, I would see the landscape change. So the houses would get bigger. There would be less, potholes and that sort of a thing. Manicured lawns, 2- and 3-car garages, the further I would go. And then it was something about, though, that act of moving further away from where I lived. And then I didn't live there, so I had to turn back around and coming back and seeing that like increase and then like decrease, and really wondering about that, really wondering about the differences in terms of resources from like fresh produce and you know, textbooks and a lot of other things, educational resources and all that other stuff. And so that intro to social class in a way really kind of connected and helped me to process some things that I've experienced that I, up to that point, that I knew were wrong and that I knew were off. And so from there, it just really developed this thirst for more like knowledge and wanting to know more about like social problems and challenges that exist. And so I would say the totality of my undergrad experience was really learning a lot about my racial identity and understanding like the ways in which I'm marginalized in that way, and recognizing like systems of oppression. And it's like, wait a minute, wait, that's not our fault. Wait a minute, in terms of like the lack of resources that I experienced in relation to growing up in Detroit versus places like Bloomfield Hills or Ann Arbor or other places, along racial lines, class lines, and other lines of identity and experience. It's like, well, wait, that's actually not an accident. Actually, there's some design that was put into why our neighborhoods are designed the ways that they are. There's some design that was put into, you know, how segregated our neighborhoods still are. And so just education was a way to really help me to understand the things that I experienced in ways. So I also learned about that in regards to a shift from the memorization that was required in some of my other courses. It came a little bit more naturally to me in the social and some of the other psychology and some of the other sciences there, because I was able to apply it to things a little bit more directly. Now, coming to grad school here at Michigan, getting introduced to intergroup dialogue, learning a little bit more about intersectionality and the ways that, you know, although I'm marginalized in some ways, I'm also privileged. It really opened up my scope in terms of understanding education. I talk a whole lot about James Baldwin's quote, to be a Negro in this country and to be relatively conscious is to be in a state of rage almost all of the time. And he talked about like that rage being, you know, not just being angry at what's happening to us as Black people, but also because of the ignorance and criminal indifference on the part of white people to understand what's happening and then also to act in ways that, you know, that interrupt that, to change it. And so the goal is to channel that rage in a way that it doesn't totally consume you. And for me, social justice education has helped me to channel that. And so it's also translated into thinking about power and privilege. And so for those privileged identities that I hold, or when I'm interacting with people in organizations, you know, what are the ways that we are ignorant or criminally indifferent to the lived experiences of other people? And so I'm very much moved by Martin Luther King's, one of the last things he said before he was assassinated is, all we say to America is be true to what you say on paper. And so he was talking about the nation at that time, you know, things that are written down about what it's supposed to mean to be able to participate in community and experience the fullness of that. And there are some glaring, and there still are some glaring contradictions between that, between what's said, what's written down on paper, and then also how people are experiencing that. And so I did school social work for a little bit and saw an overrepresentation of Black males in particular at that time in special education for behavioral issues and challenges. And I was noticing disparities in terms of like suspensions and things that, you know, hey, the Black kids would be suspended for or disciplined for, you know, kids that were white would, you know, maybe it'll be a conversation or a warning or things like that. And just noticing that. Worked with people with disabilities and their families, connecting them to services, worked in the area of domestic violence for a little bit, and then also in some other areas as well. But the shift from micro to macro came when I just noticed those patterns. That sometimes the folks who were in positions to decide like who would get what service or, you know, what intervention, sometimes carried some biased views towards the folks that they were serving. And so every roadblock that I encountered, it was either a policy roadblock or it was a person who I'm using the language of like describing it as a gatekeeper who could decide, you know, what happens or what doesn't. And then, you know, sometimes that's privilege, this idea of superiority and placing that worldview, judging the folks that they're supposed to be serving against this very privileged worldview and causing problems there. And so it really instilled in me this desire to look larger than sort of like a bird's eye view, I guess I would say, at organizations and policy and how things are done. So like this idea of if we can change the ways that we think about not only ourselves, but the people that we serve, we can change what we do on a organizational level. And so similarly, perhaps to how you all in some of your classes perhaps might have done like a social identity profile, and you're thinking about your own identities in that, doing a similar exercise, but then also looking at that organizationally. So are we talking, when we talk about like diversity, equity, and inclusion and social justice, what does our board look like? What are the people, you know, who's sitting at the table when it comes to deciding, you know, the direction of the organization and the policies and that? What does pay equity look like? If we're talking about program evaluation, how are we describing the communities that we say that we are, you know, hoping to evaluate and serve in some way? Are we describing them in a way that that paints us as like a benevolent savior, or are we actually looking at, you know, the strengths and are we, you know, a strength-based approach, those types of things.
Yeah. And we talked about that in this class a little bit.
Yeah.
This class had like a semester-long project, and one of the first things was to look at these kind of differences and patterns and things. So thank you for reiterating that.
Yeah, so using education as a way to like lessen that gap between like who we say we are as a community, as an organization, and then how that's actually felt. And that was also influenced by, this is the last thing I'll say for now, that was also influenced by experiences as a student in the School of Social Work. So in many ways, University of Michigan is, at least in my experience when I was a student, was touted as like the #1 or 2 school of social work in the country, and some, you know, World US News and a lot of other things. And so I came in as a student expecting a particular experience, and sometimes even directionally from professor to myself and other students, either students of color or who had other marginalized identities and their intersections, were having experiences in the classroom where things were being said or done, and sometimes it would go over the head of the faculty member. Sometimes faculty might not have been able to or willing to engage in those difficult discussion. And so it's just like, you know, it's one of those things that just reinforced for me, like we always need to continue our own growth and development. And also, you know, obtaining degrees and even licensure just means that we've completed a particular step, but it doesn't mean that we've arrived. And so we have to always be in conversation with ourselves and with others. Otherwise we can be harmful even when we're trying to be helpful. So
thank you.
Thank you.
Thank you. Neetu, can you introduce yourself and just share a little bit about your social work journey, which is, you know, a couple years long?
Sure. Yeah. Thank you for having me. My name is Neetu Grewal. I actually am a recent grad of U of M. I got my Master's of Social Work and my Master's of Health Services Administration. And I just finished in April during the quarantine. And, you know, it was totally weird graduating with quarantine. But anyways, I actually didn't start off knowing that I would do a social work degree. I was actually pre-med. I did a biology degree at Michigan State University thinking I would be a physician. Eventually I figured out that that was not the path for me, but I did want to be in a field where I was helping people. So at that time, I went to University of Michigan and did a Master of Social Work without knowing anything about social work and anything about where it would lead me. So, you know, during that time, it was a lot of self-awareness, learning about privilege or learning about power, and just understanding how like I was so oblivious to it all beforehand. And, you know, once you develop that like lens, you can like never make it disappear. So it was a pretty great experience for me. Overall, I did my internship at the Center for Health and Research Transformation. Carrie was my supervisor for a year, and it was a great experience. You know, I was trying to still figure out what I wanted to do. So I ended up thinking I wanted to work in hospitals and wanted to become a hospital administrator. So I ended up adding on the Master of Health Services Administration degree from the School of Public Health. And so that was also a different experience, more focused on management and I guess more, you know, accounting and stuff like that. So after that, I was still figuring out like what I wanted to do exactly, but I did want to eventually combine like, you know, social work with health management. And I ended up in a position at a place called Lorient Capital, which is a health investment firm. What they do is they invest in various healthcare companies, and my role is I'm a fellow. I'm an operations fellow. So I help with the operations of their portfolio companies, and so it's a lot of I guess management and like more macro skills. But I do see like social work skills come into play every now and then, especially things like building relationships. Just being, you know, being that person in the room who's like very good at resolving conflict or, you know, and stuff like that. So I guess I don't have as much as a long intro as everyone else, but so far still learning, and hopefully we'll get to somewhere soon. So thank you.
Well, I mean, like Rolando just said, we're all still learning too. So, you know, even if we have a few more years, we're still learning. So thank you everybody for your introductions. And you can see that there's a wide variety of things you can do with a variety of types of social work. Looking at the students' list of questions, you know, one thing that I think is probably on a lot of students' mind is, what is a mistake that you see recent MSW grads, what do you see as a mistake they make fairly soon after graduation, if anything, that you've noticed? And anybody can go if you have any comments here.
Okay, so one of the mistakes that I see a lot of the time is not choosing the correct internship, because a lot of times that is where you'll start your career. And so you want to make sure that you either reach out to individuals that are in that field or in that organization to try to secure an internship with that organization. And then a lot of times we start to see that you get a position that is very similar. So I think it's very important for you to do the legwork of where it is you want to be, and then making sure you secure that internship.
Thank you.
So I'm actually going to go in the opposite direction. I sometimes think that students too early make a decision about where they want to be. Like, I will tell you, I didn't know, right? I came in, when I entered the field, I started working with developmental disabilities, then I worked with behavioral health, then I worked with the elderly. Then I landed in child welfare, and then I realized what I was really good at was managing and running programs and being an administrator, and, you know, and I love public sector work. I wouldn't have done that if I had landed too early. And I think you need to think of your early career as a journey of discovery, and give yourself permission not to know, and that that's okay, and to experiment with different populations and different you know, fields. And I think sometimes the supervisor you have can have such a powerful influence in where you ultimately end up. The journeys that you make have so much to do with who helps you along the way, not always about you figuring it out on your own. And so whatever you do in your early career, absolutely insist on good supervision. It makes a world of difference. I have personally been in situations where I didn't have that support, and it's a little scary because you're responsible for people in whatever field you're in. So I don't disagree with what you said. I also have this other perspective that I just wanted to share.
No, that's fine, and I understand that perspective. That's good advice too. That the journey is very important.
Yeah.
Thank you.
Thank you.
I would add, this is Brittany, I would add the mistake that I made is believing a lot of the tropes about social work that you hear, that you'd never make money, that you should always be treated poorly, that you have to work 60 hours a week in, you know, old, ugly buildings where the water is dripping on your head, and you know, the parking lot lights are busted and you need security to walk you to your car. That could be true, you know, depending on what you want to do and where you are, but it shouldn't be true. The work that we do is just as important as what everyone else is doing. And if you can't find a healthy, comfortable, safe environment to do that work, then you need, you know, reach out to someone. Like Uma said about finding a good supervisor. You can do what you want to do without being treated poorly, without being underappreciated and undervalued. So I wish I had known that going in, because I wouldn't have stayed so long in positions that were not good for me mentally or physically. There's a lot, despite the fact that we're social workers, a lot of the organizations where we work do not treat their employees with respect and with care and support. And so you don't have to go through that to be a social worker. There are great organizations that pay well and do good things at the same time.
Thank you, Brittany.
I'd just like to add one more thing.
Yeah, please.
just real quickly. One thing that I mean, this is not what I've seen other students do, but what I've done myself personally is I think we tend to put ourselves in boxes that like we're social workers and we only have like a certain skill set and we can't do anything else. I applied for a job where I probably didn't have like half the skills, but I'm developing them and I'm learning them. You know, your attitude about learning new skills is very, very important. And just because a job description has some bullet points that you have no idea what they are, doesn't mean that you're not a good candidate for the job. So I would encourage you to apply to any job that seems interesting to you, or internship that seems interesting, because you know it's not, we shouldn't sell ourselves short, I guess.
That is so true. So I think, speaking of skills and learning skills, there was a question from a student about what skills are important to pick up early in the career. Even as you're testing out different types of social work or different settings, what do you think might be some important skills, especially for the students in this class who still have a few semesters to start practicing those skills?
I would put leadership at the top of my list. One of my social work professors, Schaefer, is he still there? He said this to me. Luke Schaefer, yeah.
Yeah, he's still there. Yep.
Okay, awesome. Take his human resources class if you had, or his I don't know what it's called, but his class about managing people. It's wonderful. But he said this to me, and it always stuck with me, and he was so right. You will find yourself in leadership positions long before you really feel like you thought you would be there or like you were prepared to be there. If you do good in your work, you will be managing people in no time at all. Or even if you're not officially managing people, you will be leading them. And you can think of yourself as a leader as soon as you get into the workforce. You don't have to have a title to demonstrate it. So anytime you have the opportunity to exercise leadership, the only way to learn leadership is to practice it. Unfortunately, there's tools and trainings, and you should take whatever classes on it you can. But the more situations you can put yourself in where you can develop yourself as a leader and figure out what kind of leader you are, the more prepared you'll be when you find yourself in that situation.
Yeah,
I would say that, and in addition to the leadership, just some critical self-reflection. So anytime you might have to really think about, you know, your own worldview, who am I? What are the values that I have? What do I bring into my own environments? Because I think the more you can articulate that for yourself, the better you will be able to recognize and notice and share with others in terms of the environment that you're going into, and not, I think going back to some of your comments earlier, Brittany, about, you know, hey, we do deserve to be, you know, treated with respect in our work, and we don't have to, you know, just be in any type of organizational, like take any kind of like organizational treatment, because we understand like what it is, who we are and what it is that we value. And then also connected, I think, to the leadership pieces, recognizing that particularly for those aspects of your identities that might be marginalized, many times for some folks, there can be this sense of like imposter syndrome because of all of those messages. So when you say, okay, so, you know, many times when you're in those positions of leadership, you might be there before you're ready. And then just thinking about how systems of oppression can compound those feelings of unreadiness, but really realizing that I've heard this quote that says like the people who are closest to the pain should be closest to the power. So really realizing that in many ways, those experiences can put us in a place to really understand systems better than most. And so realizing that like you do have what it takes. So the leadership pieces, critical self-reflection, and then spending some time really thinking about like noticing what's around you you know, noticing those pieces of inequity, so you can then call attention to them as well.
The other thing I would say is when you get into a new job, ask questions. Don't feel like you have to pretend that you know everything, because then you make mistakes, right? People are your supervisors, people in your workplace will be more than happy to answer questions and to ease your way in. People want you to succeed. And you have to believe that, and you have to go in there. You're not asking silly questions, is the sun yellow or blue? But, you know, if it's related to your work and you want to sort of know, how do I, you know, somebody gives you an assignment and you don't fully understand it, don't try to figure it out, because you may or may not land in the right place, right? You have to ask questions. I don't know, Neetu, if that's your experience, being new in the workplace, but I see that a lot where I'm working. We have research assistants, right? And they're fresh out of grad school or fresh out of undergrad school, and they feel compelled to be as competent or to be fully equipped, and you're not, you're forming. And we have to understand that it's our job to coach and guide and build and make sure that you are as successful as you need to be. And that has to be, you should have that expectation going into a workplace.
So we have 4 minutes left according to my clock. So this has been a really great discussion so far, and I'd like to end on a high note and ask you to say one sentence, if you can get it to one sentence, or maybe two, about the most rewarding thing about macro social work. And I can call on you if you need, but you can just go.
All right, I'll go. For me, it's been running public human services systems. There is no more powerful sort of role as a social worker to impact policy and practice that impacts the lives of so many people. And I totally get what Rolando is saying, right? We are not coming into this work thinking we're going to rescue people. We're coming in there to be part of the solution. And conveying that and building trust in communities, building those partnerships to be able to see the system shift and change. It's just awesome. So anybody who wants public service careers, I'm telling you, it's hard work, often unpaid in bad buildings. All of that being true, it's incredibly rewarding. So
thank you. Anyone else?
I would
For
say,
me,
I'm sorry, go ahead,
you go
Brittany.
ahead. I was just going to say, for me, it's about bringing resources to amazing people and amazing organizations. So the world is blessed with a high number of people who want to do amazing things. Like the social work program is proof of that. But everyone needs more resources in order to be able to do it. And I'm happy to be able to bring that to them.
And I was going to say that the most rewarding thing is opening up people's eyes to what it is that we can do and what we have the power to do, and putting on that social work cape, right? It's almost like a superhero, or that's like your superpower, and being able to really show individuals what we've been taught in school and how we can really go forth and implement those plans, just like someone with a business major.
Mm-hmm.
I would say I love that it's an invitation, similarly, to think about what is it that we can do. Like systems of oppression, there is design that is within them. Health disparities, all that stuff has been designed. So if we can look and notice the design in it, we can also imagine ways to act and design things in ways that don't replicate inequitable outcomes, or don't reproduce those outcomes, but that, you know, contribute to more equitable outcomes. And so seeing things as a design and not by accident makes it harder to just say, you know, hey, inequity is just the way it is. Well, actually, no, it's not. And so I love macro because it invites us to recognize the design, like nothing is by accident here. And so it also, and then by looking at things in that way, it can show a path for every individual on how they can individually and collectively use whatever area their sphere of influence to work to be a part of the solution. So that's what I love about it.
Thank you. Nitu, any comment?
Yeah, I think for me, the most rewarding thing about macro social work personally is being able to, I guess, understand different perspectives and having the ability to learn about the other side and being that person who can, you know, bring together two completely opposite groups of people and create change and create solutions. And I think that's a really powerful thing that social workers have the ability, and social workers have that ability. And so for me personally, on my journey so far, I found that that's probably the most powerful thing for me.
Great. Well, thank you. Thank you all for joining this panel on a Monday evening and helping the students in this intro macro methods class learn, you know, there's a lot of different things that you can do with these skills. Even if you do want to be a therapist for a while, you can still be a therapist and then go do other things while you're doing it or in addition to in your future career. So thank you all. I really appreciate it. This class is really lucky to hear from each of you who has had, you know, successful careers so far. And it's been nice getting to know all of you over the years too.